Okay, thanks. Welcome to this channel. In order to study, let me open the file. Okay. How can I share the screen? I want to share a Microsoft file. Wow, wow. Sorry. Okay. About we see about the TRV. Yeah, thanks. Today we'll see about the TRP. It is known as perforation of the wall of reticulum by foreign object, especially nails. This is its metal scan perforate and that result is on the peritonitis. After peritonitis, it might act on the vagal nerve or it affects the diaphragm. As it cuts the diaphragm, we might find that the diaphragmatic hernia maybe pounds. So this decrease in the food penetration of foreign body may proceed beyond the peritoneum and cause involvement of other organs resulting pericarditis. TRP means pericarditis, cardiac tamponade, pneumonia, pleurisy, mediastinium, and these other complications can be due to that of the TRP, traumatic reticuloperitonitis, and pericarditis. Let us see this animal here. There is a reticulum. This is the rumen. This is ventral sac of and the rumen, and this is dorsal sac of. There is sac is in the rumen. And after the rumen, there is what? Reticulum is here. After the reticulum, we might find that of the peritoneum. After peritoneum, diaphragm is here. After diaphragm, we will find heart directly. So that most commonly TRP occurs. That is pericarditis occur. The etiology is, as I said, then the epidemiology. The disease more common in the extensively managed and almost unknown in cattle that is intensively managed. Cattle but is normally found in many. The pathogenesis, when you see the pathogenesis of TRP, lack of oral discrimination by cattle leads to foreign ingestion of foreign body that would be rejected by other species. So that the cattle has inability, it is unable to eat. It is voracious. We say that the cattle will be the voracious feeder, that it cannot discriminate or search or selective eater. It is not selective eater, so that indiscriminately it will take anything. Yes, rejected by other species. Swallowed foreign bodies may lodge in upper esophageal and cause obstruction. አይመርጥም ከብት yes non-selective feeder ስለሆነ ነው በዚህ እንትን ላይ it is what non-selective so esophageal group cause bomb but most instances they pass to reticulum many lie there without causing harm but honeycomb-like structure of reticulum provides many sites for fixing of foreign bodies so because of the reticulum is honeycomb structures because the reticulum honeycomb structure ስለሆነ it might not move apomasm is what it is flat structure, but the reticulum is honeycomb structure, so that there is attached to one side of reticulum because it is not slippery. Yes, it is not slippery organ. Many sites of fixation foreign bodies, so concentration of the reticulum is sufficient to push up sharp-pointed objects through the wall. Contractions. As reticulum is non-slippery, if some object is attached to reticulum, it might first ያደርጋል ማለት ነው። We have known two sinuses. Cattle is non-selective feeder, voracious feeder, that other animals. The second one is due to this reticulum in the cattle is non-slippery, honeycomb structure. It attracts or it takes this porium habitat, especially metal. It leads to fixation in the regal matter. Then after this fixation, the reticulum will be penetrated. This is mechanical action. Most perforation occur in lower part of the cranial wall of the reticulum, but some occur laterally in the direction of spleen and medially towards the liver or a liver mural. But most penetration as a sign says, if the reticular wall is injured without penetration to the serous surface, no detectable illness occur. The foreign body may remain fixed inside for a long period, gradually corroded away. It will corrode away, but if non-detectable illness ሊመጣ ይችላል. But a piece of wire can disappear 6 weeks, but certain nails much longer and are unlikely to corrode away in less than 1 year. Wow! In 1 year ይጠፋል ይላል። If the foreign body is in a reticulum foot or inside the reticulum, it will disappear, it will corrode when it is this environment. Objects that are deeply embedded or have kinks, bulbs in the large diameter tend to remain in situ and they cause persistent peritonitis. So what knowledge does you have about the reticulum? Most perforation is occur at the lower part of the cranial wall of the reticulum, at the lower part, on the lateral in direction of other parts. But in a reticular wall injured without penetration, surface like injured ቢሆንም there is no clinical signs observed. And at this site, ይቀመጣል ማለት ነው። ባት 6 ዊክ ላይ ኮሮድ ይሆናል። አንዱ በአንድ አመት ላይ ኮሮድ ይሆናል። ሶ ኖ ስላውተር ምን ስላውተር ይኖራል፣ በጣም ይኖራል። acute local peritonitis is the first one. Initial reaction to perforation is one of acute local peritonitis. And in experimental induced case, clinical sign commence about 24 hours of penetration. The peritonitis cause ruminal atony and abdominal pain. How ruminal atony is caused is that it is due to vagal nerve ሊጎዳ ይችላል። peritonitis ካለ peritoneum ላይ ችግር ካለ if the foreign body moves back into the reticulum, spontaneous recovery may occur. A resolution of acute fibrinous local peritonitis is characterized with development of fibrinous adhesion. So fibrin accumulate ይሆናል። The wound healing process አይተናል። While the wound is healing, it forms fibrin clots. And then እነዚህ ፊብሪኖች መጥተው ምን ያደርጋሉ? ይወጣሉ። This metal will corrode ይሆናል። Yes, it has its non-living ስለሆነ ፔስታል አይደለም። It will imbibe. Motility of the reticulum is restored and the animal may recover fully. Follow-up ultrasound examination cow with traumatic reticulum in which Romanothenus then found that adhesion disappeared in mostly about 6 months, depending on the severity of local peritonitis. ራሱ ያጠፋ it will disappear by itself. This results in decreased reticular motility. Ultrasound of cow with traumatic reticulum reveals that biphasic contraction of reticular wall. persistent ሊሆን ይችላል peritonitis ማለት ነው። it will result I say that to peritonitis ሊያመጣ ይችላል። generalized የሆነ peritonitis. diffuse may occur in cows that have at the time in cattle that are forced to exercise. Immobility is prominent clinical finding, maybe protective mechanism so that adhesion are able to form localized peritonitis. Animal made to walk or transport long distance frequently suffer relapse when this adhesion are broken during the movement. So immobility, one of the treatment for TRF. Immobility. እንዳይንቀሳቀሱ ማለት ነው። yes during the ችግር የለውም። Complication are traumatic pericarditis, vagal indigestion, the last one. ይህ peritonitis ቢሆን ችግር የለም። ዲያፍራም ትንሽ ቀዶ ቤቶች ችግር የለም። ፊብሪን ክሎት እየፈረመ ፎርም እያደረገ ሊኖር ይችላል። እንደው በረቲኩለም ካለ it might not show any clinical sign ላያሳይ ይችላል። But in general, diffuse peritonitis may occur. Cows that calve at the time perforation, the cattle that are forced to exercise. Immobility is prominent clinical finding, may be protective mechanism so that adhesion are able to localize. relapse ይሆናል but TRP ከመጣ መጥፎ ነው። Less common sequelae include rupture of the left gastroepipelic artery causing sudden death due to internal hemorrhage. Penetration into pleural cavity causes acute suppurative pleurisy and pneumonia. Therapy. Now we're going to see clinical finding for therapy. What are the clinical signs? Usually, as I told about an degree speed is take high, middle, starting before 2 weeks and the total loss before 2 days. Now, ምግብ እንዳለ አቆመ። ለምንድን ነው? ይህ vagal nerve reticular ሊያጋጥመው ይችላል። So as these foreign bodies or the foreign materials skeleton, so that the pain walking downward inclination. And the cupping. ከየት ነው የመጣው? The other one, I said that this is bilateral nasal discharge አለ ያልኩት። Sweden, medium body function, alert behaviors, green into history of medication for dies in Nazareth. And the production system is semi-intensive with some exercise in yard. Not yellow. Wow. Okay, sorry. When we see that the clinical signs, acute local peritonitis kone, the onset is complete anorexia, marked drop in milk yield, zero milk, about third less of previous milk. This change occurs with 12 hours. Subacute abdominal pain, arching of back, urination cause pain just after performing infrequently and usually with grunting. Yeah, like I said, chronic local peritonitis. Again, pericarditis, we see that about pericarditis. Clinical pathology. Profound toxemia rectal examination of the cattle with acute or local traumatic may cause painful grunt when grunting sound. Grunt. Grunting sound. The animal sounds. The sound is known as grunting. Grunt. When the animal strains during the examination, the faces are usually dry and firm and covered by thin coating of mucus because of prolonged irritation. Rectal examine ቢታረግ faces የለም grunt ይሆናል reticular abscess characterize poor body condition relatively full rumen but with reduced ruminal contraction almost complete ruminal autonomy. Architect full of abdominal full abdomen no digestion. It might be there might be what no digestion. Digestion ምን ይሆናል decrease ይሆናል. Then fixing of the room was done. Then by entering the hand to room and reticulum, the internal content was assessed before starting my side in securing area. Then securing was started by Roman using coaching technique. This is a treatment ያልኩት ነው associate acute diffuse generalized peritonitis. Rumination is absent and the reticulum Roman motility. ማን ብላ ተች እዚያም ሮማን ሞቲሊቲ ቢታዘባ ምን አለ? urination decrease up to zero የሚመጣ ይችላል። no urination no defecation because of grunting sound even if defecate ቢያደርጉም grunting sound እያሳዩን defecate የሚያደርጉት ታኪፊኔ ብሪስኬት ኢዴማ nasal discharge fine on full test. Sorry, እዚህ animal ላይ computer lenses of writing in the computer. I'm not fast. Okay, the resolution is around. Hey Nick, you know the case. The owner told us about animal decreased feed intake starting before 2 weeks. Downward inclination, coughing. History medication for 5 days. እሺ ቲያሪቪ ትሪትመንትን አላየውም። Two methods of treatment: conservative treatment or without the use of magnet and hormonectomy. Both have advantage. Okay, thanks. Okay, thanks.